Hi, I'm Dr. Dan from Vitamin Pro, and we're talking about, should I wait to get a celiac diagnosis before I start my gluten-free diet? And of course, the big answer is no. There's no rationale for that I've seen that makes any sense at all. And I've spent the first 3 videos going over that, and so I'm going to try to wrap it up here with this last couple of points. Now, many good studies have shown that the only sign that a person is gluten sensitive is by neurological signs. So, there have been some really interesting studies done with this. So, these studies are not based on people who have positive antibodies in their blood, that tissue transglutaminase that we talked about, or intestinal biopsy, because in these cases those are negative. So what this innovative researcher has done, he's taken people with neurological disorders, such as ataxia, headaches, memory loss, there's a long list, 100 things. But anyway, so what he does, instead of trying to figure it out with blood tests, he does blood flow to the brain. He does SPECT scans, and then looks at MRI scans to look at the brain abnormalities. And to confirm that it's gluten, he puts people on a GFD, gluten-free diet, and then 7 or 8 months later he rechecks. And guess what? About 75 to 85% of these people, I think it's closer to 85, actually have a reversal of that abnormal blood flow to the brain, and their MRI starts to normalize as well. So this is some pretty powerful evidence. Now, what does that say for the people who tell you, gee, you shouldn't go on a gluten-free diet? Too bad if you have memory loss, or you're starting to get a little dementia, or maybe you're losing where you are in space, that kind of thing, or maybe you have some learning disabilities or something, and they say, well, you shouldn't go on a gluten-free diet until you get that celiac diagnosis. That's just wrong, and it's dangerous, and it's bad medicine. So there are many other conditions that they're in a similar type of situation as those neurological problems. Again, I encourage you to look at my website, Vitamin Pro. I've got some resources there. And I've got the list of disorders that are associated with gluten. It's on my gluten quick fact sheet. So anyway, look at that, and if you've got any of those, then it pays for you to investigate the gluten-free diet to see if that will help you. And you certainly don't have to wait for someone to tell you to do that. Now, there's another aspect of this, and that same researcher who determined from looking at 13,000 different people that the rate of celiac disease was closer to 1 in 100, because it used to be considered 1 in 5,000, but it's really closer to 1 in 100 who have demonstrable celiac disease based on those hard findings. But he calls this the clinical chameleon, because it has a different presentation in every patient that comes in. So you are going to have to learn your own body and what are the signs for you. For one person it might be acid reflux, another person it's insomnia, another person it's headaches, another person it's joint pain. So it just depends. And you're going to have to figure out which one of these are you dealing with. Some people get rashes, but they go away. But if they eat gluten, the rash comes back. So I want you to learn your own body, and you're the expert here, not some other guy. So I've given you a lot of reasons why I believe that it's absolutely wrong for you to listen to this kind of advice and wait until you have that celiac diagnosis before you go gluten-free. There's no reason to wait for that. And like I say, you can start this gluten-free diet without getting the high priest's blessing. So thank you very much for listening. I hope that's helpful.